Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist who has been in practice for more than 40 years in Houston, Texas. And today we want to talk about your heart. And most importantly, the focus of today's presentation is what questions to ask if you have been diagnosed to have heart failure. Heart failure is a very important topic in the field of cardiology, and there are hundreds and hundreds of questions that you need to be asking when you have been diagnosed to have heart failure. And here I'm going to help you how to live through heart failure. If you have been diagnosed to have heart failure, I would say get a 200-page notebook and write down the date you were diagnosed to have heart failure, and I'll tell you what are the questions you need to be asking, and make notes, progress notes, keep your lab tests, medication lists, allergies, side effects, all these things in your notebook so that it should go with you wherever you go. Every time you see a specialist or someone else, you need to have your Bible with you, your heart Bible, because that is your life story. Okay, let us begin with some common questions we should be asking if you have been diagnosed you have heart failure for the first time. First of all, what is heart failure? As you can see, here is a little heart diagram. I don't know if you can see it right here in the right hand bottom. You can see heart diagram. Let's see if there's a different. Okay, this is a good one. So here's a heart diagram. Let's say at the beginning of the contraction of the ventricle, there is 100 ml of blood in the cavity. And as it squeezes 70 ml blood. That is, it squeezes 70% of the blood that it received. So that ratio, that 70% of the blood being pushed forward, is known as the ejection fraction. It is the ejection fraction that determines the degree of heart failure in some types of heart failures, not all of them, and I'm going to show you the difference. In patients with congestive heart failure or the dilated heart failure, the ejection fraction is an important number because when it drops to 40, that means you are having the first stage of heart failure. When it gets to 25, 30, 20, then you're reaching almost stage 2 or 3. It is not only based on the ejection fraction, it is also based on symptomatology. So we have various classifications like stage 1, stage 2, stage 3, stage 4 heart failures. But that is beyond the scope of this presentation. This is to educate you as to know what degree of heart failure you have and what are the things you need to watch for and what are the things you need to do to stay healthy and away from heart doctors. So that is the ejection fraction. That tells us about the overall heart function. But that's not the end of it. Because of the heart failure, there is backing up of the fluid in the lungs that can cause changes in the lungs, leading to pulmonary hypertension, and that can translate to the right side of the heart, giving heart failure. So now you have start off with a left ventricular failure, then you develop pulmonary hypertension, then you develop right heart failure, so you have a combined heart failure. So there are various combinations of things that can happen. That is as far as the systolic dysfunction heart failure. That is heart failure with reduced ejection fraction. And here's a normal heart which pumps 70 ml and the heart thickness is normal. The heart pumping muscle is working normally, all the segments, and that's a normal heart. And look at this one, diastolic dysfunction. That is some people with hypertension or hypertrophic cardiomyopathy. That means thick muscle like amyloid condition. These patients have very thick, stiff heart muscle. So it can squeeze reasonably well, but it cannot relax. So you see, it squeezes with slow relaxation. Whereas a normal heartbeat, whereas with a big heart failure, congestive heart failure, that's the congestive heart failure. Whereas with hyperdynamic diastolic heart failure, it squeezes, but it slows, a little sluggish. relaxation. So those are some of the main features of various, so let's get back here, types of heart failure. We talked about the left heart failure, we talked about the right heart failure, we talked about the combined right and left heart failure, then I talked about the diastolic dysfunction or the diastolic heart failure. What are the most common complications of heart failure? Heart failure leads to progressive symptoms of weakness, shortness of breath, fatigue, leg edema, hepatic congestion, fluid retention, and a whole host of things. And along with that, we develop irregular heart rhythms. It could be atrial fibrillation or it could be ventricular tachycardia, in which case you may need not only a pacemaker, but may also need a defibrillator. And as the heart failure gets worse and worse and worse, it leads to kidney failure. Then we're going to have multi-system failure. So that's the sequence of events in a Faure advanced heart failure, like somebody in class 4 heart failure whose ejection fraction is like 10, 15%. What are the most common conditions that lead to heart failure? Coronary artery disease is one of the most important ones that leads to myocardial infarction or a heart attack. If they have multiple heart attacks, there's a lot of scar tissue replacing the pumping muscle. As a result, the heart dilates and it becomes flabby, and that leads to cardiomyopathy or congestive heart failure. And sometimes we get viral myocarditis that can lead to heart failure in younger population, but that's a very small percentage. The second condition is hypertension. Long-standing hypertension can lead first to hypertrophy, thickening of the heart muscle, but eventually it will dilate, going into congestive heart failure. The third condition is, of course, kidney failure, which leads to volume overload, hypertension, and all of these combined together can lead to heart failure, systolic heart failure. And of course, we have the valvular heart disease like aortic stenosis or mitral regurgitation that can lead the rheumatic heart disease and heart failure related to that. How does heart failure affect daily? Patients with advanced heart failure, like class 2 to 4 or a higher degree of heart failure, or short of breath, they can hardly walk from the mail room to the gate. They can hardly walk inside the house. They are short of breath just sitting down. They have to use oxygen. Whereas patients with mild heart failure, like class 1 or class 2, they can be normally functioning. He could be a CEO of a billion-dollar company and still function normally. So the symptoms vary dramatically between the various stages and how well the heart failure symptoms are controlled with medications. How do we assess heart failure? There are a number of tests we do to assess heart failure. First of all, we do an electrocardiogram, which will tell us the heart rate, the heart rhythm, and also evidence of heart enlargement and any evidence of previous myocardial heart attacks or myocardial infarctions. So the electrocardiogram gives us a lot of information about the patient's heart. And if we do like a 14-day monitor, we can also look for any irregular heart rhythms like atrial fibrillation or ventricular tachycardia, which can be more serious complications of heart failure. Then we can do an echocardiogram to look at the heart size, the heart function, the heart valves, and see how the heart has transformed due to whatever the insult may be, like a heart attack, hypertension, renal failure, or valvular heart disease. Then we can also do like MRI to look for scar tissue or decrease in circulation. We do stress tests to see if some of these heart muscle segments are viable, to see if they can be subjected to coronary artery bypass surgery or stenting. So those are some of the tests we do. And how quickly does the heart failure progress? Heart failure, coronary artery disease, diabetes, arthritis, hypertension, these are chronic conditions. They slowly progress over time. But the good news is, by drastically modifying the risk factors, by drastically taking preventive steps, we can decrease the rate of progression of these chronic conditions, minimize the symptoms, improve the quality of life, and live a more productive, useful life despite having these challenging problems. Let's continue here and see I talked about these various types of heart failures and what likely caused my heart failure. So as I said, if somebody is sitting in your front, you need to look at their chart. Does this patient have coronary artery disease? Does this patient have advanced hypertension? Does this patient have valvular heart disease? Does this patient have irregular heart rhythms, which can also lead to heart failure? Does this patient have like a virus infection in the past? Did this patient have like amyloidosis or chronic aging conditions? Then we talked about the severity of the heart failure, which is classified as class 1 with minimal to no symptoms. Class 2 is minimal symptoms with normal activities. Class 3 is symptoms with minimal activities. And class 4 is symptoms at rest. And it is also based on the structure of the heart as to how significantly the heart function is deranged. I talked about diagnostic tests that we use and should you enroll in cardiac rehab program. Yes, indeed, not every place you can find cardiac rehabilitation, but there are places where you can find cardiac rehabilitation. What does cardiac rehabilitation do in patients with heart failure? It improves their exercise tolerance. It improves their walking ability given the same heart condition. As a result, you are reconditioning your body to do more work with the available resources. It's called the 6-minute walk time. By giving proper medications, by reducing the salt intake, reducing the fluid intake, we can improve their exercise tolerance. And most importantly, remember, in patients with heart failure, what we are focused is quality of life. Quality of life. And minimizing the symptoms and improving their functionality. So these are the things which we are focusing on. And can the symptoms get worse? Absolutely, the symptoms can get worse. If you just drink too much fluids, you can go into heart failure and then end up in the emergency room. If you drink too much, if you take too much salt, then that can lead to fluid retention and oxygen, call the ambulance. I mean, you get the picture. Or if you develop more damage to your heart muscle, or if your blood pressure is out of control. So there are a lot of dynamics working here. So you need to understand your underlying heart condition causing heart failure and how the underlying conditions, your lifestyle, your diet, and your fluid intake, and your medications can interact with each other and make things worse from time to time. And also people get infection, they get a flu or a pneumonia, then their heart failure can get automatically worse and put them in the hospital. Okay, what lifestyle changes can I make to feel better? This is a very important question. And as I said, if you have heart failure, it is a serious condition. And there's a serious underlying problem, as I said, coronary artery disease, hypertension, or valvular heart disease, or like cardiomyopathy. And these things need to be taken seriously. And whatever the recommendations you get from your doctors, you need to follow it religiously, because it is your life that matters and the rest of it doesn't matter. You could be the CEO of $1 billion company. It doesn't make a difference if you can't just walk from your car to the parking lot, from your car to your workplace. Daily activities, playing golf. I think people with heart failure in class 1 or class 2, as I said, can lead a very, very productive, useful life by taking the medications, limiting fluid intake, limiting salt intake, maintaining body weight. If your body weight goes up more than 2 pounds, you need to call your doctor or the nurse and see what you need to do to get rid of that fluid. Otherwise, that evening or the next day, you could be in the emergency room. How can I reduce stress and anxiety? I have a whole different video on how to reduce stress and anxiety, and please watch that one, because stress and anxiety is an integral part of any chronic illness, especially when you have a heart problem and a heart failure and you're huffing and puffing. This anxiety can make things worse, and you may be feeling more short of breath because of anxiety. How do I explain to my family and friends? Well, simple. take your family with you when you go and talk to your doctor. And as I said, your 200-page notebook should be full of questions. In fact, I have given you a reference here by eMedicine. They have over 100 questions that you can ask. Write down all those questions and get answers to those questions. Maybe record it, because you need to be in the driver's seat when it comes to dealing with heart disease, heart failure, because this is a lifelong partner of yourself and also your family. What happens to you affects your family. It has a cascading effect on your family. But you can lead a very productive, useful life if you follow the medical instructions, understand the underlying problem, understand the interaction with diet, medications, and fluid intake. Then you can be an educated heart failure patient and function normally. What are the advanced treatments available for heart failure? What happens? Your heart functions like 10% and you can hardly get up from the bed. Well, there are some options available. It's called the LVAD, which is supposed to support the left ventricle if it's completely failing. Then the ultimate option would be to do a heart transplant. And of course, that's a whole different topic. You have to meet so many different criteria to be eligible for heart transplant, and that's a pretty long process. I had patients who had heart transplant. You're talking about a year to 2 year process, unless this is an emergency, for them to go through medical, psychological examination of heart, lungs, kidneys, everything else that needs to be evaluated, and it has to be approved by a team of experts before you can be put on a transplant list. Hopefully you don't need to get to that stage, but if you understand what heart failure is, and if you understand what is your role, because your role is the most important one, because you're the one who is living with your body all the time. You see doctors for 5 minutes, nurses for 10 minutes, and that's it. But you're living with your body 24 hours a day, so you need to be the master of your life and craft out a game plan that will keep you healthy, happier, and away from doctors. Thank you so much for watching this presentation. I am Dr. Nik Nikam. I just enjoy sharing information that is of educational value to patients with heart disease. As I said, I've been a cardiologist for 40 years. And if you have any specific questions about heart or heart failure for that matter, please put them in the comments and we'll maybe create another video. As I told you that eMedicine, there are more than 100 questions there. I may go back and do a part 2 of heart failure questions in the future. And please do subscribe to our YouTube channel, and I will see you in the next video.